Okay, thank you everybody for joining our webinar today. We have our webinar topic is HIPAA high-tech requirements and security risk analysis. My name is Monique Dever and I'm today's moderator. First, we're going to go through some of the housekeeping stuff. If you're not familiar with the GoToMeeting webinar screen, you'll see this dialog box where you can communicate with us. This red arrow here will expand and shrink that box, and it'll always remain in view. If you have any questions, you can submit them in the questions box, and we will get to all of those questions at the end of the webinar. I know our presenter today has some poll questions, so he will be probably leading off with that, with the poll questions, so he'll drive that part of it as well. Today's presenter is Mr. Srini Kolathur. Srini is the director of EHR 2.0, and he has several years of experience in helping companies effectively comply with regulatory requirements, including SOX, PCI, HIPAA, etc. Srini believes and advocates best practices-based security and compliance programs to achieve business objectives. He's also the one that has managed our security risk assessments here at Patagonia Health, and is likely to do that with many of our customers in the future. So at this point, I'm going to go ahead and turn the screen over to Srini, who can begin his presentation, and give us just 1 minute while we switch screens. Okay, you got that?
Thank you, Monique. Thanks for the wonderful introduction, and good morning, good afternoon to everyone on the call. How you are doing? Okay, great.
Yep.
Are you all able to see my screen?
Yep.
Okay, great. As Monique mentioned, I'm part of EHR 2.0. What do? We pretty much work on the security and the HIPAA compliance requirements for healthcare entities. And how do we do it? We have two different wings. One is the educational arm, which does like the online trainings, webinars, and the customized workshop for covered entities and business associates. And then the consulting part is where like we conduct security risk assessment and also the HIPAA compliance assessment for healthcare organization. That's a little bit about our company, and our attorney wanted this one up before even we start speaking anything. So I'm not going to go through the text here, but I will leave this one up here for a few seconds. Okay, the bottom line is consult your attorneys if you have any fact-specific situation like a data breach or reporting of the particular incident to OCR and other entities. Okay, so here is a quick agenda for today's webinar. We are going to be talking about a little bit background about what is the HIPAA requirements and how to conduct security risk analysis, and what are the things that needs to be in scope for your analysis, and also some of the takeaways and our approach for the security risk assessment. So you are not going to be becoming an expert at the end of this webinar in terms of conducting the security risk assessment. Definitely, I will try to cover some of the key components of security risk assessment and HIPAA assessment, so that in case if you have to do it yourself, you definitely can use some of this material and do it yourself. With that, actually, I'm going to just put some of these acronyms up front and make sure that you all understand what is that we are going to be talking about in the next 45 minutes to an hour or so. HHS stands for Health and Human Services. That's the main entity responsible for enforcing, making sure healthcare organizations are complying with HIPAA requirement. OCR stands for Office for Civil Rights. OCR is attached with HHS, and OCR is the specific entity, in fact, enforcing all the HIPAA requirements on covered entities and business associates. HITECH stands for Health Information for Technology and Economic Clinical Act. So that's the updated form of HIPAA, and we will be talking about what exactly is HITECH Act and what are the things that have changed as part of HITECH Act. HIPAA, of course, a lot of you are very familiar with HIPAA, and PHI stands for Protected Health Information. It is not personal health information or patient health information. It is protected health information. I have a separate slide that specifically talks about what is protected health information and why you need to care about protected health information. So before we get started, actually, I wanted to do a quick poll to find out where you are with respect to some of these questions. So the first question actually I'm going to launch is, have you conducted your security risk assessment in the last year or so? So all of the questions that are being answered by you is going to be kept anonymous, and so we are not going to share that with anyone else. So please feel free to go ahead and answer. I'm going to be sharing the details of the survey also after the questions are closed. Okay, great. I'm going to give you another 10 seconds or so. Go ahead and select your answer. If you are not sure, definitely pick not sure as well. Okay, so this is pretty much the number we get from rest of our webinars as well. So this is not new. So I'm just going to share this information with you. So as you could see, about 21% of you who are attending the call have conducted your security risk assessment in the last year. That is pretty good. And so now you are attending this webinar just to make sure you have covered everything. So the 54% of you have chosen no. That means you haven't conducted the assessment. So definitely you want to seriously consider conducting one, at least in the next few months. I know, like, for most of the public health departments who are actually attending this webinar have the budget period, where you get kind of decide what are the priorities that you need to plan for the next year or so. And then 25% of you not sure. Again, that's not going to help you as well. So all of you, I'm going to put all of you in pretty much the same category. About 70 to 80%, doesn't matter what kind of customers or the attendees we have in the webinar, that's the number we get. About 70 to 80% of the attendees have not conducted security risk assessment, although it is like one of the fundamental requirements for being HIPAA compliant. Right. So, and then, like, I have another question which I'm going to launch. If you could go ahead and answer for that also, that will kind of help us. So are you participating in the Meaningful Use program now? I think it's called MACRA this year. So if you could go ahead and answer this question as well, that will be good. So I think, like, the question should have been updated a little bit here. So are you attesting for 2017? If you could read that as yes, attesting for 2017, not 2016. I think the attestation period is over for 2016 already. So that will be good. So participated in the past. Okay. So looks like about 75% of you have already voted. So I'm going to go ahead and close this poll as well. So let me go ahead and share the survey results. So about 32% of you are saying yes, you are participating. 26 participated in the past because, like, there is a lot of paperwork and stuff. You've decided not to participate, and 16% of you saying no, and 26% not eligible, of course. Okay, so that kind of gives you an idea. The reason actually we have this question here is part of one of the key requirements, key objectives for attesting to meaningful use is to conduct a comprehensive security risk assessment, right? And have all those documentation ready, whether you get selected for prepayment audit or post-payment audit or whatever it is, right? Whenever CMS or the state agencies give out money, then they are entitled to audit you. So you definitely need to maintain the documentation for conducting a comprehensive security risk assessment. Believe it or not, we get a lot of calls from our customer base that they are getting inquiries from CMS and Medicaid agencies for producing the SRA report, which they have not actually formally documented, although they have kind of noted down a few things, but they don't have any formal report that they could actually submit to CMS or other auditors. So again, there is another important reason for you to consider conducting a security risk assessment. So I'm going to go ahead and just close that poll, and then move on to the other important things. So if you see here, we kind of summarize the reason for conducting a security risk assessment in 5 different areas, right? So the first one is, of course, a lot of security breaches are happening. So you probably must be aware of the WannaCry ransomware that's going around, and that is because people are still running obsolete software, Windows software, and that's not being patched properly, right? So that is causing an issue. And then the item number 2, we already discussed about it. Number 3 is definitely security assessment is going to kind of reveal what are like some of the areas that you need to improve on, and what are the security best practices that you need to implement in place. That is another reason that you definitely need to consider. And then, of course, civil money penalties. I have a separate slide on that. I'll discuss that in detail with you. And then the last one is, of course, the patient trust. Unless, like, now these days, patients have options. They don't need to come see you. They could go to some other private practice and other services. Or even these days, a lot of tele options available for patients. They don't need to come see you. So to maintain patient trust, definitely you need to have that one in place as well. So here are some of the examples, specifically with respect to public health, because most of the audience today is from the public health department background. So if you want to learn more about the specific situation, you could go to HHS website. You could do a Google search on HHS data breach report. They will list out, actually HHS lists all the data breaches that are reported to them, whether it is like 500 or more individuals or even less than 500 individuals. But these are like picked up from their list, and so you can go and see the specific reason why they have been breached. So, but if you want to, if I have to kind of summarize what all the different reasons for the data breach. So number 1 is unencrypted tape. People. So remember, all these data breaches that are reported and being investigated are all like 2010 to 2014 range. A lot of that, like the 2015 to current period, they are not even being investigated yet, although there is a big wait list, right? So if you look back, right, so a few years ago, cloud backup was not a big deal, meaning people were still kind of very relatively concerned about moving to cloud, and so they all had in-house a tape which was not encrypted. So that's why the unencrypted tape is popping up as the top of the this thing item. So, and then inadvertent emails, you are supposed to be sending out an email to patient A, but it went to patient B, or like a much larger group, right? So again, that is something that you need to note down and then report it based on your particular situation. Next one is data disposal techniques, which are not proper. Say, for example, your laptop is out of commission and you're disposing the laptop without properly sanitizing the hard disk that is in there, or like even your copier machine or any electronic devices that is capable of storing this patient data. You used it, but during disposal, you are not properly sanitizing the data before disposing it. So that is another reason. And theft by staff and hacking, if you really see, like those are in terms of the percentage of the data that are breached by theft of staff, and hacking are like very, very minimal. But still, those are like some of key reasons for the data breaches in the public health space, at least, right? So here are the settlement amounts in the last 2 months. Actually, HHS is getting really, really aggressive in terms of going after some of the entities who have reported data breaches in the past. So as you could see, 2 days ago, there was this particular entity, like I think it was St. Luke's Hospital in New York. They got fined for about $400,000 because a particular employee emailed or faxed the information about a patient, HIV patient, to a wrong person, and then so it actually to the employer of that patient. So that created a big deal. And then in fact there were 2 incidents like that, and they ended up paying about $400,000 fine. And then again, like these are hyperlinks. I'm not going to go over each one of this particular incident. These are hyperlinks, or like if you want to go to HHS website directly, do HHS settlements, that is a keyword. You will be able to go directly to HHS website and click on that link and look into the detail of the press release. And also as part of the press release, as part of the settlement, HHS and the defaulting party also come up with a separate contract that is so that contract is also uploaded on HHS website. You can look into the detail of that as well, right? So just a couple of examples in detail. Care New England system, again, like unencrypted backup tape went missing, and if it goes missing, if it's not encrypted, you are assuming there is a data breach. Somebody else got a hold of it, and they can read the data that's in the tape. So that is considered as a data breach. And they had IT company, the parent company was providing IT services, but they didn't have a BA agreement with them. So they ended up paying $400,000. And again, like Skagit County, Washington, they had they basically put like about 1,000 patients' data on a public web server, which was pretty much accessible to everybody. People who can do Google search, they were actually getting access to these files. So, and they did not even provide breach notification, so they ended up paying about $215K fine. So as you could see, these things are like pretty common, and people are reporting data breaches, and HHS is going after them, and they have to pay a huge sum of like civil money penalty, and then they come up with the corrective action plan. HHS provides them a corrective action plan and monitors these entities very, very closely for the next 1 year or so. So you end up spending a lot of money, a lot of time, and a lot of resources in making sure you are following through this corrective action plan that's provided by HHS, right? So this was the case before the HITECH Act. If there is any complaint filed by a patient or a third party, then it's basically reviewed by HHS, and they kind of decide whether further investigation needs to be done or just a notification to be given to the defaulting entities, right? And then like they come up with different resolution options. One is they find no violation, or they come up with voluntary compliance, or they provide a formal finding of the violation. With the HITECH Act, actually what happened is there is a new program called OCR audit program, which some of you might be very familiar with that. I have a separate slide on that as well. So what happens is OCR could pretty much pick any entity who's handling patient data, and then they could pretty much have them go through the entire process, and that could eventually end up in civil money penalties if applicable, right? So the reason actually we wanted to have this slide up here is there seems to be quite a few not only complaints, pending complaints, but also the OCR audit that's happening in the industry now, and so that is another reason for you to be conducting the security assessment and HIPAA assessment. So here are like the categories that you could potentially fall under, depending based on your situation. If your violation, you didn't know about the violation, for each record, actually, it could range either from $100 to $50,000, right? But then they capped it at $1.5 million per calendar year, depending on your situation, right? And if you had a reasonable cause to believe that you had a violation but you didn't take any action, then per record they could penalize you up to $1,000. And then if it was a willful neglect but corrected, about $10,000 per record, and then willful neglect not corrected, it goes up to all the way up to $50,000, right? So again, like they get really creative. All these things are handled by attorneys, and so they come up with different clauses. Hey, how many clauses of HIPAA requirements you violated, and for how many number of days you violated, and then like they come up with this big number. So that's why actually most of the penalties, if you see, they are running into millions of dollars, right? And most of them are pretty big organizations too. So this is what actually we're talking about, HIPAA phase 2 audit, the OCR audit I was referring earlier. So OCR, they did a phase 1 audit of some randomly picked entities way back in 2014, and they developed a protocol from phase 1 audit, and then now in the phase 2 audit, actually they are again auditing about 200 to 250 entities. That includes not only healthcare organization, it includes business associates like IT companies, it includes accounting firms, attorney's offices who are handling patient data, right, and providing services to this healthcare organization. All of them are included as part of this phase 2 audit, and now they are in the desk audit phase, and they are going to eventually come up with a much more fine-tuned OCR audit protocol that could be used pretty much by any organization who's handling patient data, and make sure that they are HIPAA compliant. So the difference between the HIPAA rule and the OCR audit protocol, the way we see it is, OCR audit protocol is much more elaborate. HIPAA, they just talk about, well, you need to be managing or you need to be reviewing the log files of your key system. That's all they say. Whereas in OCR audit protocol, they kind of talk about, little bit at least specific about, what are the logs that you need to be reviewing. You need to be reviewing your network logs, you need to be reviewing your EHR system logs, and you need to be reviewing your other key system logs and things, right? So that's the way actually we see it. OCR audit protocol as, provides a little bit more information in terms of, what all the specific things a covered entity or a business associate needs to be doing. So let's now take a step back and see what are like really the requirements from HIPAA HITECH perspective. The way we see it is, there are 3 primary components for the HIPAA HITECH rules. First one is the privacy. Most of you who are on the call today, you are directly seeing patients. So privacy, the confidentiality of this protected health information, making sure the papers that you collect from the patients and all the information that you process as part of the patient engagement or healthcare, that all needs to be kept confidentially. And so that is the privacy part of the requirement. And then the security is whenever like you kind of convert this information into electronic form, then you have this electronic protected health information. So the security is mostly applicable where when you convert this patient data into electronic form, all this security rules gets applied. Right? The breach is only when it happens. Let's say if there is any data breach, meaning like you send some information to a wrong person or wrong employer, then what you will have to do is what all the notification steps that you will take in order to notify patients, and how will you maintain documentation regarding that, and how will you report it. Those are the components of the breach. So those are the 3 different components of the HIPAA HITECH rules. And then like if you see the enforcement and audit, even if you are not following any one of this particular area, right, the privacy or the security or the breach part, then you need to be, you could be potentially audited, and then the civil money penalties could be applied. Right. So what are like some of the changes that happened to HIPAA as part of this HITECH modifications? So I think like about 50% of you said like you're participating in meaningful use program. So that was straight out of HITECH Act. Meaningful use program was introduced as part of HITECH Act. And then they changed the liability and responsibilities of the business associates. So they are directly liable. So that is the main change they've made. So they are directly now liable for complying with HIPAA rule, and if there is any violation, then HHS can go after them directly. And then the third one is, of course, they redefine what a data breach is in terms of like how to determine if it is a data breach. If it is a data breach, then how to report it and things. So they clearly provided more directions in terms of data breach. And then, of course, the notification standards, they made it like a 60-day period, within 60-day period from the date of discovery, you need to be notifying patients. That's what, was introduced as part of HITECH Act. And then enforcement, I think like we looked at that slide already, OCR audit program was introduced as part of this HITECH Act. Then they also raised the penalties for violation. Before HITECH Act, the penalties for violation were not like 1.5 million per calendar year. So it was much less. And then also, of course, the HIPAA 5010, ICD-10, all these codes were introduced as part of the HITECH Act, which we are not probably going to be covering in this webinar. But just a small note, there are close to about 30 billion dollars that were given out as part of the Meaningful Use Incentive Program. That's a very popular program. A lot of physicians that we deal with and a lot of hospitals, they are participating in the Meaningful Use Program. Of course, and now a lot of providers and hospitals are, increasingly interested in the MACRA program as well, because the penalty and the incentive for that is, up to 9%. So here are like some of the HIPAA titles. I'm not going to go into the detail of it, but if you see the section that we are covering today in the webinar, that's the administrative component of the HIPAA title, that is the security side of things, right? So if you do a deep dive into that particular security requirement, this is the way they kind of, specify what all the requirements for the safeguard requirements for the patient data. So as you could see, these are defined at a very high level. So HIPAA, there is only one HIPAA rule for like any type of entity, whether it's a solo practice or whether it's a major hospital who's handling like thousands of patients every day, right? So the idea for defining the security rule at a very high level is to keep it kind of flexible based on the entity type, based on what is applicable, what is not applicable, based on the exposure, risk exposure. These entities need to decide what is applicable for them, what's not applicable for them, and document the same. Right? That's the way like they kind of define the whole thing. But the three main safeguards as part of the HIPAA rule is the administrative component, which says you will have to be conducting the security risk assessment on an annual basis, and then having a compliance officer making sure the information that's being accessed, is by the right people, and making sure the training is happening to all the staff. All these requirements are defined in the administrative side of things. And then if you look at the physical safeguard, which is increasingly becoming more and more irrelevant, because most of you on the call, if you are with Patagonia Health, then where is your physical physical patient data stored? It's not stored on your premise. It's all stored in the cloud, and somebody else is supporting it. And so all you need to do is making sure you protect the end devices that are accessing this data, and making sure that you change the passwords, and then you don't download any reports into your end devices, right? Those are like some of the physical safeguards that you need to keep in mind. So then the next one is the technical safeguard, where it gets more technical in nature in terms of who needs to have access, whether the front desk administration person could have access to the clinical notes that doctor is recording, and who's updating it. Are we reviewing those things? Those are like some of the requirements on the technical safeguard side, right? So this is, in my opinion, is the most important slide, right? The protected health information. This is something actually we talked about in the very beginning of the webinar as well. So when you combine these 18 elements that are listed on the left side of your slide, when you combine them with some of the clinical information of the health data of the patient, medical records, pretty much everything in the medical record, as you could see, history of the patient, treatment information, and other chart information, the claims or the payment, eligibility, everything. when you combine these two, that's when it becomes protected health information. So when we do the assessment, we essentially identify the scope of the devices, scope of the system based on where you're storing this PHI. A lot of times you might have few systems that's just capturing patient name and address, and you may not store any information whatsoever related to that particular patient's clinical information in those systems. So are you going to be providing a similar kind of security best practices of the security configuration for those systems compared to the system like your key EHR system, which stores pretty much all this information together, right? So those are like some of the things actually we kind of determine based on the scope, based on the way that you store information on things, right? So this will pretty much drive your HIPAA compliance efforts and the security assessment efforts as well, right? So if you're just storing like one or two elements that are listed on the left side, then most of the time it may not even be in HIPAA scope, right? But one thing, actually, we recently updated this slide. The one thing that I wanted to call out specifically based on some of the recent settlements with HHS, the highly sensitive patient data, which includes some of the HIV status, sexually transmitted diseases, medication, the orientation, sexual orientation, and mental health diagnosis. All this information are considered highly sensitive. Most of you who are on the call, I'm pretty sure like you have one or other services geared towards some of the things that we are talking about here. So you will have to provide additional precaution to make sure all the information that are stored in this system are kept secure, and you are reviewing these logs regularly, making sure that only the right people are accessing this data. That's another important thing, right? So the way we kind of categorize or identify different activities that you need to do in order to comply with HIPAA or these 5 different areas. First one is the policies and procedures. Most of the practices that we consult with, they do not have a comprehensive security policies and procedures. For example, what will be their sanction policy or disciplinary policy in case if one of their staff is violating the policies, right? So they do not have a written process of how they will go about handling it. That is covered in the policies and procedures. I have a separate slide that talks about what are the different policies and procedures that you need to have. And then, of course, the second thing is documentation. What I mean by documentation is whenever you get audited, pretty much auditors are looking for a documentation of how have you checked all the user accounts that are in your EHR system to make sure they are current and all the terminated users are disabled from your systems, and they are looking for your log review documentation, how frequently you are reviewing the logs and things. Those are like some of the things that are covered in the documentation side of things. Of course, the training of staff, security awareness training, that is like one of the most important thing as well, right? So with all this ransomware and a lot of the things that are going on in the industry now, staff training is much more important than anything else in the picture, right? So how do you train your staff? How do you make sure that they are taking additional precautions before sending any email out, before clicking that send button, or before downloading that report, or clicking on the email that comes with the URL that's pointing to somewhere else, right? Those are the things that is covered as part of the staff training. Fourth one is the BA agreement and contract. This is probably one of the easiest thing, but not many of our customers who we engage with have not done it. It's like you will have to have the list of vendors you are doing business with. And then the next question you need to be asking is, are you sharing patient data with them? If you are sharing patient data, then do you have an updated business associate agreement with them? If not, that is probably going to be the easiest step that you could do. We have seen in few cases HHS has penalized people for not having proper business associate agreement sharing the patient data. So you pay attention to this particular item as well. And then the last one is the same security. And so pretty much all the applications that you use in your practice. So
Okay, can you hear us now? If somebody could just post into the questions. Yes, okay. Thank you.
Great.
Thank you for letting us know that.
Sorry about that.
Okay, so maybe we should back up a slide.
We should back up a slide. Okay, great. Let me go ahead. Yeah, I think we were kind of covering the different components that are required to be in compliance with HIPAA and HITECH. First one is the policies procedure. I have a separate slide for each one of those topics, so we will just in the interest of time, what we will do is we'll quickly review that. Policies procedures, definitely you got to have, including like the sanction policy, what is your background check, and information security, how frequently you're going to be updating patches and whatnot, right? So that is in the policy and procedure component side. And then the documentation part is essentially, you know, how you are complying with this requirement, the HIPAA HITECH requirement. That's what they are looking at from documentation perspective. That includes, you know, you are providing training to all your staff regularly on a yearly basis, whether you have documentation for all of that. Are you reviewing all the audit logs that are being generated from your EHR system and other system? And are you properly managing your record request logs for your charts and all those other information? That's what they are looking at in the documentation side of things. And then staff training is probably in my mind is the most important one, you know, with all the ransomware and other things that are going on in the industry. So definitely making sure that your staff is aware of what is that they need to do. First, like let's say if they see some unusual activities, let's say if their system is acting weird, or if they clicked on something and then they lost their control, right? So what is that they need to do, and how to, you know, handle emails that are coming with, you know, enter your password here and all those sort of things. That is all going to be covered as part of your staff training, right? And they also want you to maintain the content that is used as part of your staff training as well. Fourth one is the most easiest one to accomplish in my mind. The reason being, you know, all you need to have is, you know, essentially have this business associate agreement in place with any vendor that you are doing business with. How would you go about doing this? Say essentially you need to have the list of vendors that you are doing business with, and then the next question you need to be asking is, are you sharing patient data with them? If you're sharing patient data with them, then definitely, you know, they are a candidate for having a business associate agreement with you. So you need to update your agreement, making sure that, you know, you have that in place. The reason actually we have I say this is a very important one also, like easiest one to accomplish. HHS settlement, if you look at the previous settlement, HHS has even penalized few entities who did not have the agreement but still shared the patient data with them, right? So if you are running into that kind of situation, definitely, you may not have any help. So you want to make sure that you have all these things in place. And then the last one is the technical security risk analysis. So that, I think like that's where we probably lost our audio, I guess, right? So if you look at the technical security risk analysis, so what are like the things that are covered as part of this analysis? So it covers your EHR system, it covers your lab information system or patient management system and radiology and whatnot. Any systems where you are storing patient data is all covered as part of the security risk analysis. So some of you might ask, why, like say if you are managing a cloud-based system, if you are just using a cloud-based system, do you still need to include that as part of your scope? Yes, the reason being there are a lot of things that are handled from a provider perspective. Say for example, creating a user and providing roles and responsibility to that particular user and setting the timeout for some of these applications. If you are idle for a few minutes, then how to time out, and then patching some of these systems and all this information. All those things are could be potentially controlled by the provider, so that's why you all need to be including that as part of your security risk analysis. And then, of course, the end devices, whether it is your laptops, desktops, mobile devices, and stuff, everything needs to be included as part of your security risk analysis. And then storage devices, your hard disk, floppy disk, CD, DVD. If you have patient data in it, then definitely that's going to be part of your scope, right? Because we go to a few places where they use radiology services, and then like they copy the particular X-ray, whatnot, into the CD and then give it to patient. So that's all going to be coming under the scope, right, as part of your assessment. And then, of course, the networking devices, don't need to emphasize that more. So any device that is kind of, transmitting data from point A to point B, obviously, you need to keep them up to date with respect to their firmware, patches, and log on like username, passwords, and encryption and stuff. Those all needs to be included as part of that. And then smartphones and tablets, of course, they are becoming more and more predominant in the industry now, and so definitely you want to include them as part of your assessment as well. If you are using smartphones for sending emails, receiving emails, and texting patients and stuff, so that needs to be included. And then cloud-based services, what is included essentially with respect to cloud-based services is to make sure you have this updated business associate agreement with these providers, right? Whether it's a Dropbox or Google the business account, business email, or Patagonia Health for that matter, right? So whether you have this BA agreement with them, those are like some of the things that you need to make sure. And then any other interfaces, there are, like depending on your practice, depending on the way you're set up, there could be other interfaces also that potentially could be in scope for your security assessment. So we are not going to get into the detail of how to conduct the security risk assessment. Essentially, what I would say is making sure all the systems and the devices are following the security best practices. Number one, provided by the vendor. Number two, provided by the industry or the authoritative sources. Making sure all those things are in place is what like you are essentially going to be assessed for, assessing for, and then figuring out how the data is, how much exposure you have. And then based on that, you are going to come up with this essentially prioritized risk sheet where you say, hey, based on the impact you're going to have and the likelihood of that happening. Let's say you have a traveling staff and they are using their laptop but downloading reports and stuff in their laptop. Then if you haven't encrypted their laptop, then it's a huge risk, because a lot of the data breaches that are reported, if you look at it, it's just because people have lost their laptops or tapes which are not encrypted. So again, the good thing about HIPAA is if it is encrypted, you don't need to report it. It is not considered as a data breach. Only if it is unencrypted, you need to report it, right? So that's the way, like, you kind of, based on your situation, based on your particular circumstance, you will decide, whether it's a high priority risk or medium priority, low priority, right? At the end of your security risk analysis, you will have list of recommendations. That doesn't matter, you're a big practice or small practice, you will have list of things that you need to implement as part of this security risk analysis, and then you kind of decide, how you are going to prioritize all those things. That's the way, you will decide. So one thing the auditors are asking these days is your risk management plan as well. So apart from your actual report of the security risk analysis, they also want you to provide them with a plan on what are the risks that you identify, how we have categorized them, and how soon you are going to be fixing them with a date, right? So that's what they are asking for with respect to the risk management plan. So that is about the security risk analysis part. And then in the policies and procedures, as I mentioned in the very beginning, so it could be a master policy, information security policy, that pretty much contains all this information, right? Or it could be individual policies based on the different areas. It could be the physical security policy needs to have what kind of maintenance record you have, who's entering into your data center or computer room, and for what purpose and how long they were there, and what kind of activities they were doing. And then if you have the inventory of all the devices that are storing this patient data, then you need to have the disposal records as well, right? How are you disposing this information, and are they safely being disposed? Those are the information. And then in the information security policy, you will say, who's allowed to have access to your system, who's not allowed to have access to system, and what kind of roles they are going to have, and how soon you will, update your records if there is any change to their roles and things. Those are like the information that will be covered in the access policy. And sanction policy, I think like we kind of discussed that already. And almost all of you need to have this contingency plan policy as well, right? So what will you do in case if there is a natural disaster, or in case if there is an emergency, if there is a power outage, if there is an internet outage, if your system, Patagonia system is not available, how would you go about accessing it? Or how would you go about providing care? Those are the things that needs to be covered as part of your contingency plan policy. And then the last thing is the security incident procedure. You have all these policies and you have all these good procedures in place. Still things happen. So if it happens, how would you go about handling it? Who would you call first? The security officer or the compliance officer, and what kind of immediate steps you would take, and how would you report that to the impacted patients, and all this information needs to be covered as part of this security incident procedure. Looks like, Monique, we have a couple more minutes, right? Okay, good. So, and then training, I think we kind of covered this already. Again, like you need to have different content based on the roles of the people, right? What kind of activities they are doing. So if it is staff, front desk staff who's handling different type of, who's doing different type of activity, then you need to have separate training for them. If it's management, you need to have separate training for them. So that's about the training part. And I think like the BA agreement part we already covered. So the best way to identify all the vendors who are doing business with you is to go to your account payable system and get the list of people you are making payment to, and then figure out if you are sharing patient data with them, and then come up with a plan, and then go and see like if you already have agreement with them. If not, then update your agreement, right? So, and then the documentation part, I think like we already covered that. These are like some of the documentation the auditors are looking for. Have you shared your privacy notice of privacy practices with your patient? Have you got their consent and signature from them that they have received it? And if there are any update, have you shared that with them? And then health record request law. This is mostly for the privacy part of it. And then the training records. Every year, like when you train your staff, you need to maintain the logs of all the people who got trained and what content you used to train and stuff. All this information needs to be maintained and documented properly. So those are like some of the things that you need to make sure that you have a process in place to capture it, keep it safely, so that if the auditor comes in, like say as I mentioned here in the slide, up to 6 years worth of documentation could be requested by the auditor. So you need to have a good process in place to store all this information, make sure that it's readily available. I'm going to just skip that slide, which specifically talks about the encryption requirement and thing. But at a very high level, the summary that I wanted to you to take away from today's webinar is enforcement is on the full swing, and processing of your PHA elements pretty much drives what are the things that you need to be scoping for your assessment, and how to come up with the comprehensive security risk analysis report, and then the documentation part of it, right? So also based on our assessment of the public health department, you guys have a wide footprint of patient data. You have several different services provided, and several different applications are being used for storing this information. So have you considered the security risk of all this different system? Have you documented all those things? That's what actually is required for your team. And then the last one, of course, the budget and the type of organization that you are in, and also the size, pretty much determines. But it doesn't matter, whether you are managing one set of patient data or like thousands. You definitely need to have all these things done, right? So there are quite a few references actually here that are listed here. All of them are hyperlinks. If you're able to click on it, actually Monique is going to be sending out the deck to you after this presentation. So you can actually click on these links, and directly you can go and view some of these references that are listed here. So also, like, some of you have requested for some high-level pricing guidance in terms of how much it would cost to engage our services. So we have this up here, but again, it is just high-level guidance. Up to 30 users and 2 sites, approximately it's going to cost about $3,000. And then, like, if there is any additional number of users and additional sites, then accordingly you need to calculate as well. And then if you have any on-premise systems, say for example, a lot of places that we go to, they have their in-house email systems or in-house system that are being used for storing other type of patient data. So then for additional system, it's going to cost like about $500 per system. And then external network assessment, a lot of you have access, meaning access from outside to your network. So that means like you definitely will be going through an IP. So depending on the number of IPs you have, we are going to be charging as well. So this is again high-level guidance. What I would request is, okay, so maybe I'll just cover at a high level what are the things covered as part of our deliverables. So all the things that are listed here is what like we were discussing so far, right? Maintaining the inventory of all your systems, the security risk analysis report that is requested by auditors, the risk management plan, policies, procedures, training, online training, an executive summary report, and storing all these documents. We provide a secure portal as well to store all this information, right? So, and also if you are hiring us for doing consulting, we also provide audit support. Let's say if you get audited, if you are the lucky one to get audited, then we can provide you audit support as well. Right, so this is our portal screenshot where we will store all your reports, documentation, and things. So the next steps are, if you are interested in our service, definitely go to ehr20.com, request for quote, or on our website, on our homepage, you should see a link for requesting for quote. Click on that and submit your information, and we will get you an estimate within 24 hours, and then like we'll send you the contract as well once you decide to proceed. So typically, it takes about 2 to 4 weeks for us to complete the engagement. Again, like it depends on the size and the scope our engagement, but typically it takes about 2 to 4 weeks to turn in all the reports that that you saw on the earlier slide. With that, I think we can open it up for questions, Monique.
We do have some that have already come in.
Okay.
Some very good questions here. The first one is, as local public health, we have many contracts with our state health and welfare. We have asked, but they insist we do not need a BA with them. Your thoughts, please.
This is with which company, which organization?
They
are local public health company.
Local public health with their state health and welfare department.
Gotcha. So I think we probably can take that offline, and technically the requirement is anybody they are sharing patient data with, they are supposed to have a business associate agreement. So if the State Department is saying that they don't need to have BA with them, then I would try to get that in writing and document that to make sure. Also, the issue will be let's say the local health department gets audited, and it is their responsibility to ensure they have the agreement. And if they are not, if the State Department is denying, I think the local health is going to be having a problem if they get audited. So I would say, try to get that in writing, and we can take that offline also to discuss this particular situation.
Okay. The next question is, will this presentation document be available to the attendees? We've addressed that, and yes, we can get that over to you. The third question was, how frequently should a security risk analysis assessment with a report be done? Annually or more frequently?
Yeah, so the recommendation is annually, and if there are any major changes, let's say if they are moving from on-premise EHR to cloud-based EHR, then that is again another time that they need to do, although it is not due until the next year. So that is whenever there is a major technology change, or at least annually, that is the requirement.
Okay. So if anybody has any other questions, please go ahead and put those in the questions box. We would like to apologize once again for the technical glitch we had earlier with the phone line. And while we're waiting for questions to come in, I also would like to let you all know about our next up webinars. It's called Innovative Approaches to Pleasing Our Customers. It's scheduled for Tuesday, June 6th, and then repeated again on Friday, June 9th at 1 o'clock Eastern Time. If you can't attend either of those and would like a recording, go ahead and register for the webinar anyway, and then you'll get a copy of the webinar once it has been recorded. So again, we're going to hang on for a couple more minutes here, see if anybody has any further questions. If anybody didn't get their question answered accurately, just please send me a note and I'll get you connected with Srini. Is your risk assessment done on site is the next question.
Yeah, so most of our risk assessments are done on site, and we could do, if for some reason, if they have budget issues and things, we could definitely do remotely as well.
Okay, well, if nobody has any further questions, we'll go ahead and log out. If you think of any further questions after we hang up, go ahead and email me those, and we will get them answered for you. In the meantime, again, our next webinar is Tuesday, June 6th and June 9th, Friday, Innovative Approaches to Pleasing Our Customers. Enjoy your long Memorial Day weekend, everybody, and we look forward to having you join our next webinars. Thank you, Srini, for presenting today. We very much appreciate you coming back in for an ENCORE event.
Thank you, Monique. Right on time.
Right on time. We like it that way. All right, thank you, everybody. Have a nice day.